I'll be your nurse for today.
I'll try to help with
The doctor ordered NG tube, so I'm gonna do that for you today. If you can just verify your name and birth date, please. Okay, I'm gonna elevate the bed a bit.
I didn't write much. I wrote very little.
And then I'm gonna put you on high powers. Get my area ready. Okay. Doesn't have to be a sterile fold because it's going into the stomach. Ask the patient if they prefer nostril. If they have a nostril they prefer. Check for any, check the nostrils to see if there's any irritation, to assess which one you can also use. And then I'm gonna lube. There's lube, but I'm gonna lube the tubing so it doesn't irritate the patient. But in this case, I'll lube the mannequin. Or okay, there's lube. Here's my lube. And then I'm gonna measure the tubing. So from the nostril to the ear to the xiphoid process, and then I'll add about 2 more inches, and then place a tape here. I already have one, so I'll use this as a measurement, a guide as to how far to go in. And then I'm gonna have, you can fold it a little bit so it goes down. You're gonna have the patient have their head up, and then we're gonna go in gently, but keep going. And then once you get to this mouth area, you're going to make sure it's not coiled in there. If it's straight, then you'll have them drink some water. Okay, have them drink water as they're drinking. You keep going down. As far as you can, and then you're not going to get so far because of the mannequin, but make sure they're not having shortness of breath or anything, because if they are, then you probably went into the lungs, so you're going to pull out a little bit, not all the way, until they feel more comfortable. They complain about discomfort. And then once you get down to your point, you're going to flush with some air, about 30 cc. And then you're going to listen to the abdominal area to check for the swoosh. So then you're listening, air, you hear that, then you can pull until you get some stomach content out. And then once that, you see that, put it back in. And then you send the patient off to x-rays to make sure it's, the placement is correct. Once you get confirmation, before you let go of everything and you send them off, you're going to secure the tubing in a loop. It's messy. this was done before you even checked for the air, so that it's secure in place and it doesn't come back out. And then you send them to x-ray, and you get confirmation that everything's put into place. If suctioning is ordered, you then connect it to the suction tubing and you turn it on as ordered. Ask the patient if everything is okay. Then you can lower down the bed again. And then secure, pull the rails up, secure patient, give the call light, ask if they need anything, you document, and then